Did you know heart disease is the leading cause of death in men in the United States, killing almost 350,000 men in 2007? That's about 1 in every 4 male deaths. Hi, and welcome back to our channel. What's even more shocking is that half of the men who die suddenly of coronary heart disease had no previous symptoms. The term heart disease can refer to several types of heart conditions, including coronary artery disease and heart attack. There are several causes of heart disease, from high blood pressure, high cholesterol, to smoking. Heart disease can sometimes be silent and isn't diagnosed until you've experienced signs and symptoms like a heart attack or heart failure. This can be a dangerous situation. Identifying the signs and symptoms of heart disease early can be vital to controlling it. In this video, we'll be telling you what the signs and symptoms of heart disease are, so keep watching. Number 1. Shortness of breath. If you've been experiencing shortness of breath, even without doing any laborious work or tiresome activity, you may have heart disease. Breathlessness or shortness of breath is common for people with heart disease. Your breathing and your heart pumping blood effectively are very closely related. Your heart pumps blood so it can circulate to your tissues as well as get oxygen from your lungs. If your heart can't pump blood properly, you can feel short of breath. Difficulty breathing after physical exertion can indicate a problem in your heart valves. Another reason for your shortness of breath could be due to inflammation and the weakening of your heart muscles. Number 2. Chest pain. Chest pain or angina is a classic symptom of heart disease. The type and duration of chest pain indicates the underlying heart disease. This painful condition is sometimes the precursor to cardiac arrest, although it can also recur for years without triggering any more serious symptoms. Angina can manifest itself in a variety of ways, including a feeling of heaviness in your chest, pain, or squeezing sensation, weight on the chest, or deep pain that causes you to catch your breath. The pain that you experience can be short-term, constant, stabbing, or sharp in nature. It can last for a few seconds to hours. You may mistake angina for heartburn or indigestion, particularly since you may feel pain in other areas of your body as well, including your shoulder, middle or upper region of your back, or even your jawline. Number 3. Excessive sweating. Sweating more than usual? Especially if you aren't exercising or being active, it could be an early warning sign of heart problems. Pumping blood through clogged arteries takes more effort from your heart, so your body sweats, trying to keep your body temperature down during the extra exertion. You may also experience cold sweats or clammy skin. Night sweats are also a common symptom of heart trouble. If you wake up and your sheets are soaked or you can't sleep due to your sweating, this could be a sign of heart trouble, and you should consult your doctor immediately. Number 4. Swollen feet. Swollen feet or edema is another indicator of heart disease in men. When you have heart disease, one or both of your heart's lower chambers lose the ability to pump blood effectively. As a result, blood can back up through your legs, ankles, and feet, causing edema. Edema can also occur when tiny blood vessels in your body leak fluid. The fluid builds up in surrounding tissues, leading to swelling. Although edema can affect any part of your body, you may notice it more in your hands, arms, feet, ankles, and legs. If fluid builds up too quickly, you can get fluid in your lungs. If your heart failure is on the right side of your heart, edema can develop in the abdomen. Number 5. Fatigue. If performing simple activities that don't require much exertion is causing you to feel exhausted, you may be suffering from heart disease. Potential heart disease can cause exhaustion due to the extra stress on your heart that's trying to pump blood while an area of blood flow is blocked. If you're often feeling tired or exhausted for no reason, it could be a sign that something's wrong. Unusual fatigue and sleeplessness have been shown to be an early warning sign of a heart attack. You may also experience fatigue just before a major heart attack. Sometimes you may experience chest pain and fatigue, but the nausea may be much more prominent, so you may mistake the symptoms for the flu. Number 6. Heart palpitations. Palpitations make you feel like your heart is beating too hard or too fast, skipping a beat, or fluttering. You may notice heart palpitations in your chest, throat, or neck. They can be bothersome or frightening, but usually aren't serious or harmful and often go away on their own. In rare cases, palpitations can be a sign of a more serious heart condition. Get immediate medical attention if they come with shortness of breath, dizziness, chest pain, or fainting. Number 7. Difficulty keeping your hands and feet warm. This condition is also known as atherosclerosis, and it may be an indicator of heart disease. Your major arteries can get narrow or even blocked due to the buildup of plaque from too much cholesterol. Years ago, it was referred to as hardening of the arteries. As your arteries become clogged, blood flow to and from the heart is restricted, forcing your heart to work harder. This can cause poor circulation, leading to difficulty in keeping your hands and feet warm. Number 8. Pain in unexpected areas. When it comes to heart disease, the first thing that would come to your mind is chest pain. But discomfort related to heart diseases can occur in other parts of your body too. It can manifest in your stomach, legs, especially calves, arms, especially your left one, jaw, and back. This is due to the narrowing of the blood vessels that bring blood to the other parts of the body, increasing your risk for heart attack. It happens when the fatty materials like plaque build up on the walls of your arteries. Poor blood supply to your body parts can lead to pain, achiness, fatigue, burning, or discomfort in the muscles of your feet, calves, or thighs. Symptoms may often appear during walking or exercise and go away after several minutes of rest. You may also feel pain in your legs and feet when you're at rest. Your legs may also feel cool to the touch, and your skin may look pale. Number 9. Snoring during sleep. Snoring when you're sleeping can be more than just a sign of being tired. You may be experiencing sleep apnea, which can lead to heart disease. Sleep apnea increases your risk of heart disease and other cardiovascular problems. With sleep apnea, you could stop breathing for 10 to 20 seconds or more while sleeping, and this can occur several times during the night. If you have significant sleep apnea, chemicals in your brain that trigger breathing fail to function, and ultimately oxygen levels go down greatly. When this happens, there'll be a surge of the levels of adrenaline, cortisone, and other hormones, which contribute to a variety of heart conditions. As sleep apnea prevents restful sleep and increases stress hormones, it's linked with high blood pressure, which increases the risk of heart attack or stroke. Number 10. Chronic cough. Have you had a cough which is not going away even after medications? Chances are you may be having heart trouble. A persistent cough is not always a sign your heart has a problem, because it's a symptom of many common illnesses like a cold, flu, or bronchitis. But a never-ending cough can be a sign of a fluid buildup in your lungs, which is a sign of congestive heart failure. When you have a heart problem, your heart becomes weak. It's not able to keep up with the oxygen demands of your body. As a result, the blood pressure within the heart builds up and causes a back pressure into the lungs. The fluid buildup in your lungs can result in a persistent cough or wheeze that can produce phlegm, which is a thick, mucus-like substance that may be tinged with blood. When this happens, you'll get a chronic cough, especially when lying flat or exerting yourself. Number 11. Sore gums, jaw, or mouth problems. You may be wondering, how could sore gums possibly mean there's a problem with my heart? It's not accurate to say that if you have gum disease like gingivitis, then you definitely have a heart problem, but gum disease and heart issues are often related. Your gums are very vascular, meaning they're full of blood vessels, and your mouth is full of bacteria. If you disrupt the gum layer even a little bit, you're going to get bacteria into your bloodstream, which can go anywhere and trigger inflammation throughout your body. If you have open wounds and infected parts of your mouth, it would allow bad things for your heart to flow directly to it, affecting your heart's overall health. Have you ever experienced any of these signs or symptoms? Did any of them surprise you? Let us know in the comment section below.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of Bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.